We're here today to talk about cardiovascular health. Specifically with men, we want to make sure that they get to the doctor in an appropriate time. It's very important to go see your primary care physician and know your numbers. The most important thing we often start with is cholesterol numbers and blood pressure numbers. Your blood pressure will be two numbers, a top number called a systolic and the bottom number called a diastolic. We want that top number to be below, say, 135 for the most part. There's some variability in that depending on your risk factors and whether you have other conditions. In terms of your cholesterol is composed of good cholesterol called the HDL, bad cholesterol called the LDL. It's important to have that LDL cholesterol as low as you can have it. The things that really affect that are going to be your family history, medications, activity level. Your diet is very important in your LDL cholesterol, and genetics obviously plays a role. Another test that may be helpful is the coronary calcium score. It doesn't need to be done on everyone, but in certain patients, that CAT scan that involves a very short little time under the scanner without an IV can give you a sense of your risk going forward. I use that test often to kind of help patients understand their risk. And perhaps do that every 5 years or so if needed to help them understand what they might need in the future for medications and the kind of things that are going to prevent that having heart disease later. Many times I will have patients who will come in and they'll talk to me and they'll say, you know, I didn't think I was doing anything wrong, and how come I ended up with heart disease? I was basically eating pretty well and doing some activity. And what I tell patients, it's really about risk. It's about percentages in some ways. We want to lower your risk. Someone who does everything right can still end up with heart disease at a relatively young age in their 40s or 50s, and those are patients we can help, because if we can help you at 40, that's going to give a much longer benefit to you as we're going along with heart disease. And certainly even in your 50s and 60s, prevention's always important. It's easy to get involved in life and be busy with work and kids and family and enjoying life, but we need you to every once in a while make sure that you're checking in with your primary care physician, making sure that you know what your risk is going for your cardiovascular health. And if there is something that needs to be looked at a little further, we in cardiology are happy to help and happy to be the next point of contact for you. It's time to do you and your family a favor. It's time to go get your health checked. It's time to go see your primary care physician and understand your cardiovascular risk. The time is now.